Good morning and good afternoon and good evening. Well, it's good morning for me in Australia, but it's good afternoon for Dr. Rob in the US. So we are live and we're very excited. It's always a joy and a treat to have Dr. Rob with us. So today we're going to be going over the applications of laser therapy in your practice. And this is going to be a fantastic session for any doctors, any clinicians who have considered laser therapy, thought about laser therapy. And obviously we're joined by the incredible Dr. Rob Silverman, who needs no introduction, but I will quickly give you a bit of an introduction. So he's chiropractic doctor, clinical nutritionist, Amazon best-selling author. I believe his book, Inside Out Health, A Revolutionary Approach to Your Body, went to #1 on Amazon. And with 6 different degrees in clinical nutrition, he maintains a busy private practice. He's the founder of Westchester Integrative Health Center, specializes in the treatment of joint pain using functional nutrition, along with cutting-edge science-based neurosurgical approaches. So thank you so much, Dr. Rob, for joining us today.
Thanks for having me. It's a pleasure to be here. I'm excited.
We're excited too. So obviously today's session is sponsored by a fixed sponsor, Acronia, and we do have a giveaway. So if you've been thinking about applying laser therapy into your practice or introducing it, we are currently giving away an XL R8 handheld cold laser, which is incredible cutting edge technology. It's valued at $7,400 US, and the link to enter is here on the screen. So you can jump over to fix.sport/contribute. And for every donation, essentially, that goes into the Fixed charity, which supports education, student scholarships, research, volunteers at games, you'll earn tickets to win this incredible handheld cold laser. And Dr. Rob will show us through right now the applications of how such laser therapy can be applied into your practice. So, Dr. Rob, I will kick it over to you, and I will push myself off the screen.
Well, we look forward to seeing you in a moment. Again, I'm excited to be here. I've been using laser for about 10 years in my office. I've used it in a multitude of different manners. I've used it for sports injuries. I've used it to help with gut injuries. Huge imprint on concussion patients, being able to help them get through their concussions. And one little gem right away, it's able to change the phenotype of the macrophage M1 and M2, therefore twisting and turning the brain into an anti-inflammatory situation. So before we get any deeper than that, the Accelerate is a great little handheld. I have something that looks just like it. I actually have the EVRL here. I wanted to show you that also. The Accelerate is a handheld laser. You know, it's really funny. I was doing a lot of research. I'm writing another article on laser, and I was astonished to find out, and I was checking with a lot of other laser people, lasers actually go back to the 1904, where they won Nobel Prizes for helping with conditions. More commonly, or most people really attribute to the 50s and 60s when they saw laser start to grow, and it's where their birth began. However, lasers now are what I call everyday, in that they should be used every day in a manual practitioner's office. So what they do in a nutshell is they decrease pain and increase range of motion, or as I like to say, they increase ATP, oxygenation, and neurotransmission. Some of the big points about laser are, and the biggest point I would have to say would be the wavelength. The wavelength really depicts the properties that the laser will share with the person. So the Accelerate is a red laser, so it has a wavelength of 635. Its basic functions are to allow for musculoskeletal healing, again, decrease in pain, decrease in inflammation, and also really increase action potential. So it's great for nerves. More so than that, it's able to stimulate what we refer to as the parasympathetic nervous system. And I can tell you that anybody who suffers from any kind of anxiety, any kind of injury where that sympathetic nervous system is too high in that autonomic chain, really being able to get that autonomic nervous system through the parasympathetic to balance out is a big deal without question. So I've used the Accelerate for wound healing, again, sports injuries. Some of the more common sports injuries are ankle sprains, knee injuries, lower back, stiff neck, rotator cuff. It truly enables me to treat a litany of different conditions, and it's all through the red light. So what I like most about the Aconia laser is that the Aconia laser has an FDA clearance, and that FDA clearance is for decreased pain and increased range of motion. everybody always asks me, how did I come by laser therapy? Like, why did I start? What was the reason that I started to use it? As evidence, I'm sure everybody's noticed, I have what you call congenital torticollis. So I have a lateral ipsilateral flexion because my SCM is shortened and a contralateral rotation. So I've always had a musculoskeletal issue. And that's kind of like why I went into chiropractic. Went into chiropractic because I was treated by a chiro, and the bells went off when he treated me. I was motivated. I was moved. I couldn't believe how much better I felt. There was nothing that the typical medical doctor had for me, although they tried. More so than that, getting into the idea of chiropractic, I needed something to treat myself. My neck was getting quite fused. The joints weren't moving, and I needed something that I could use on myself. You can't adjust yourself. I practiced alone at the time, so I didn't have anybody to help me. I was doing 12-hour days, so I picked up the laser to treat myself, and it really saved me. That's one thing that I think chiropractors don't do enough. They don't treat themselves. They don't take care of themselves. It's a very physical job. We're always bending, we're moving, especially in the sports genre. I'm about 185 pounds, so I think that's 85 kilograms, excuse me. And in that, sometimes we have 250, 275, 300-pound athletes, pure muscle, and you have to move them and carry them. And, it can be very damaging to your overall physical structure. What we do is, without question, physical. So we as chiropractors have to do a better job of taking care of ourselves. And the laser afforded me that. It was revolutionary because I really at the time wasn't sure how long I would be able to practice. So, 10 years more with another 10 to 20 years looking at still doing hands-on work, the laser really saved me. So then I used it on my friends and my family, and everybody loved the outcomes. What's great about it is not everybody wants that thumb. Not everybody wants that elbow. Not everybody even wants an adjustment as much as it's disconcerting to me. But the laser, which I'll demonstrate for you in a moment, really has, nobody can say no to it because they don't feel it per se. And I'll segue into that a little bit more. But that's my story with the laser. A couple of stories with people in my office. Some of the bigger sports people have really loved it in that they found that the laser afforded them outcomes that they didn't get with some of the more traditional treatments and some of the treatments that were a little bit more typically done in chiropractic. Laser is synergistic with chiropractic. We know, for instance, adjustment works. We know that laser works, especially the Aconia laser, because the Aconia laser is FDA cleared, but they work synergistically together. So the adjustment works better when you use the laser, and the laser works better when you use the adjustment. So whether you're using soft tissue release, like active release, instrument-assisted soft tissue release, like Graston or Factor or even cupping, the laser is going to work with it hand in hand, no pun intended. So here I have what we call an EVRL. The only difference between the EVRL and the Accelerate is that the EVRL has both a red and a violet light, and the Accelerate has a red light. So you just turn it on. It's easily programmed. It's got a beautiful front little space where you can see everything, and you just literally, once it's programmed, you press start and you can apply it. So the red light, you can see real clear. I have a blue, so let me get it on my skin so you can see the blue and the violet light. So the red light would be the Accelerate. And again, you can just point and shoot, point it at one particular area. You can take a greater distance to cover more of a surface area. You can get it close. And if you really want, you can put it on the skin. So I usually try and get the skin if I can. It does go through the clothes. You can ask any questions that you like. I can see the chat. And you probably want it about 2 to 3 inches from the body. That's really where it's going to work best. Now, what I like most about the laser is its ability to also allow for motion. So for instance, if I had a shoulder injury, I'm going to extend my arm out like a supraspinatus and bring it back and put it behind my back. I still would be able to laser my shoulder. So I'm going to treat myself, bring it, move it. I'm still able to get motion in the shoulder and apply the laser. A couple other little tricks that I like about the laser, and everybody will love the Accelerate, in that I can use it for any kind of brachialopathy or brachial plexus. So I'm big on what I like to refer to as upregulating the nervous system. So here's the brachial plexus. You just upregulate the nervous system and go in here. You're also able to do different parts of the brain. So I'm obviously doing the frontal, top, the different lobes. For me, the big point would be this cerebellum right behind here. So it's really shown to do a great job with the brain. I do laser my brain. I know I'm sure I'm opening myself up to some commentary. I typically laser my brain virtually every day. It, without question, helps with memory. Also, it's great for focus. And to be quite frank, with all the traveling and all the things that I do and everywhere I go, it really helps with what we like to refer to here in America as the angst, a short term for like anxiety, the butterflies and things like that, because you're always going. But one thing that I really wanted to share, maybe one of my favorite protocols, is the vagus nerve protocol. So we all know that the vagus nerve goes from the brainstem, the medulla oblongata, down through their transverse colon, attaches to the outside of the transverse colon, and through neuropods actually gets inside the colon and communicates and senses with what's going on in the gut. Now, for me, the gut and the gut-to-brain axis in this communication is critical, because I believe that the gut-to-brain axis is a superhighway to health. And I believe that vagus nerve tone is a critical element. One of the ways that you can test vagus nerve tone, you see me wearing my Aura ring. My Aura ring will give me what we call heart rate variability. So heart rate variability, the higher the heart rate variability, the better your vagus nerve tone. The lower your heart rate variability, the lower your vagus nerve tone. So vagus nerve is the captain of the ship of the parasympathetic nervous system. So you want that tone to be high because you want to balance between, as I said earlier, the sympathetic and the parasympathetic nervous system. So real simple, you would turn your accelerator, your EVRL on. You would start right here and you would go down the medulla oblongata, down through, going to stand up a little here, the transverse colon. So come back up, and I'm doing a vagus nerve stimulation. Anybody who hasn't had a vagus nerve stimulation will benefit from this. So once again, I'm going to do vagus nerve, medulla oblongata, down through their transverse colon. I'm not going to stand up. The transverse colon's here. I can do that a little bit and try and get you here and come back up. Now, the vagus nerve should be called the vagus nerves because it's blue. There's one on each side, as we all know. So we could do the vagus nerve, medulla oblongata, down through the transverse colon on the left side also. So a couple of little quickies on the vagus nerve. And the reason I'm showing you this is it's usually one of the biggest one protocol takeaways that everybody likes. You can also get part of your vagus nerve by simply just putting it in the carotid sheath. You can also get the auricular section of the vagus nerve and get it right in the ear. So the auricular, it's going to break off over here and go through into the ear or right behind the ear, and you're going to laser right in the ear, both sides. So to summarize what's going on, medulla oblongata down through the transverse colon, 3 to 5 sweeps each side, carotid sheath, auricular portion, and you had a vagus nerve stimulation. You try it, use the Aura ring. You'll see a drastic difference. You'll know exactly when you stimulated your vagus nerve because these are detectables and trackables, and I happen to love them. I also have an HRV in my office, but I'm just saying this is easy and you can do it at home because as you see, I'm home, I'm relaxing. And I was curious, Megan, do we have any comments or questions as of yet?
Right now, no. So you're covering everything for everybody, but this is your opportunity to ask questions live. Obviously, Dr. Rob's here with us live. Even if you're catching the replay, which I know much of the Fix family do, catch the replay afterwards. We'll also embed it permanently in our pages on the website. Feel free to ask questions. We can pass them on to Dr. Rob as well. But right now, we're good.
Excellent. So some of the more interesting questions that they ask me about laser is, do you feel it? Is there heat? No, it's low-level laser. It's a class 2. So there is no heat. So what is the true function? What am I, if you will, firing out from here? I'm firing photons. Photons go into the body. They get absorbed by the body by a light absorbing portion of the cell membrane called chromophores. They get into the cell and they stimulate vibration, oscillation, and again, ATP, oxygenation, and neurotransmission. The key, or what I would call the nugget, it is electromagnetic transfer of energy. That's what the laser does. And that is chiropractic, if you will. If we can get that electromagnetic transfer of energy and manage and modulate the systems to communicate, because the body's all interconnected. So if we're able to upregulate cellular communication, we've upregulated healing and we've upregulated communication. So I use the laser to communicate through the multitude of systems. As we all know, there's 12 to 14 systems in the body. If we can sync them all together, we're clearly going to have a better functioning unit or a better functioning body. And clearly all our patients will be healthier. In a sports light, because it is fixed, once again, it really speeds up the injury. So many people, and again, I'm going to refer to a sprained ankle. And the reason I refer to a sprained ankle is twofold. It's the number one sports injury and has the highest recurrence rate of any sports injury. So I think a third of the people that have a sports injury have an ankle sprain, and ankle sprain is about 80% recurrence. And one of the reasons that a sprained ankle recurs so much is, number one, the lack of proprioceptive work that practitioners do. So clearly, when you look at an ankle sprain, you're going to do some proprioception. You can put them on a rock or a wobble board, and you'll also be able to incorporate the accelerate by using the back of the head and the cerebellum. In addition to that, some of the other points and why it always recurs is the area just doesn't heal, and it heals with scar tissue. So you want to get that laser on that ankle right away. And when you get that laser on the ankle, you're going to stimulate healing at an exponential level. So when you look at healing, healing occurs in what we call 3 different phases. You have our acute phase where it swells, it gets red, and there's a lot of inflammation. Then we get a subacute phase. So think of that ligament, and ankle sprain is usually the anterior tibiofibular ligament, most commonly sprained. So that particular ligament now is going to be in what we call a subacute phase. So there's going to be repair and remodeling. So collagen starts to lay down approximately on day 4. So you definitely want to get the laser in there. You definitely want to get some supplements in there. And you definitely want to get some exercise rehab in there to align the collagen, to allow the healing to start and align in a parallel form versus a perpendicular form. When your ligaments are parallel like this, they will move and they'll be able to slide and glide. When they heal in a perpendicular form, that's when you get scar tissue. That's when they get tight. And that's when the ankle feels that it's just not moving, don't have the flexibility. You're losing toe extension. You're also losing some dorsiflexion, and you're just not going to perform as well. So the laser works with all the reasons why, if we can use the example of an ankle sprain, why that would be so prolific to use with an ankle sprain and so healing. I always like to refer to the laser when I use it on different sports injuries as my salubrious type of modality, without question. Now, concussion is fascinating in that, I started treating concussion about 5 or 6 years ago out of a need for the local area where nobody was really addressing the concussion. And concussion is extremely deleterious to everybody's overall health. And it also damages the gut, because the brain and the gut are communicators. So the takeaway there is whatever you do to your gut, you do to your brain. Whatever you do to your brain, you do to your gut. So when you damage your brain, you damage your gut. Here's a factoid. 60% of people after concussion have what we call small intestinal bacterial overgrowth. We call it SIBO, high incidence of leaky gut. So you really want to be able to do 2 things. One, really help heal that concussion in an expedited manner. Number 2, be able to address the brain and the gut, and the accelerate and your corneal lasers enable you to do that. So once again, I will turn on the laser and I'll do what we call like a hairbrush. I'm big on my hair, trying to be neat. And I'll brush my hair. And that would be, you would be here for working with somebody for about 5 to 10 minutes. If not, you could just have a stand and you could hold it and it would move and you would find a tremendous change. The data is robust on using the laser to help the brain heal. It creates an anti-inflammatory environment, and it actually allows for the release of something called BDNF, brain-derived neurotrophic factors. Brain-derived neurotrophic factors allow for brain neurogenesis, meaning that neurons can grow back. Those neurons can grow back. Therefore, you're having brain neurogenesis, i.e., you're ultimately having positive neuroplasticity. So the laser is the anchor, if you will, to help concussion resolve. Now, most people will come into a concussion over a duration of time, meaning that they've had the concussion a week ago, a month ago, 5 or 8 years ago. You're really not going to get them where they're fresh. What you would want to do with the concussion is not only would you want to laser, once again, the brain, you would also want to laser that vagus nerve, and you would also take the accelerate and laser over the gut. If you want some more frequencies or you want some more specific protocols when you see this live and or Memorex, just ask. I'll be happy to share my concussion protocol. And let me give you a couple of insights on nutrition since we're talking about concussion, because I'm sure now that I mention it, every sports doc has somebody who has a concussion and they want to go back and treat. So here's some of the things that I would recommend nutritionally. Get fat in their diet. Do not give them sugar. Sugar, carbohydrates, that's a dirty fat. Sugar, carbohydrates, that's a dirty fuel. Fat is the fuel that your brain can work on. So you want fat, you want ketone bodies, you want medium chain triglycerides. You also want magnesium. Magnesium L-threonate was studied by MIT. 2 grams of magnesium L-threonate helps resolve brain tissue damage. In addition to that, it decreases the aging of the brain by 9 to 14 years. L-glutathione. Glutathione is the master antioxidant. It's shown in studies to decrease brain tissue damage by 70%. You need a large number of my pluripotent omega-3 fatty acids because it works through so many different pathways. So fish oils, you want like 6 to 8 grams of fish oil. Vitamin D3 with K2, of course. D3 is really shown to be neuroprotective. And one of the hidden gems, something that I talk about a lot, is something called pro-resolving mediators. PRMs are fabulous in that they allow for the decrease of expression of chemokines and cytokines, meaning they decrease this type of inflammatory releases. And lastly, I really want to reiterate what I said before about the laser. The laser changes the phenotype of the macrophages in the brain, which are called the microglial cells. And they do so you're no longer inflammatory. And that changes a whole panacea of what's going on in your brain. So I'm going to pull Megan back up. I want to see if you had any questions. I don't think I saw any before.
No, we're still good.
No?
I think everybody's just intentively listening. Did take away at the beginning when you were talking about, though, that not enough chiropractors actually work on themselves. I think that's, like, for me, was a big takeaway too. And obviously you're at home right now and you have the lasers with you at home, which is right there with you. Perfect.
Right there with me. Just like I have my laptop, just like I have my lights to do my social media. Everywhere I go, on a serious note, I have the laser. Now, what's beautiful about this, and I'm going to piggyback on something that you just said, in that you can treat yourself. I can take it on vacation. I can take it when I lecture. I can keep it in my pocket. I can take it to the pharmacy. It's small. It's can I have a cell phone? So here's my little handy dandy cell phone. Here's my laser, and it's literally the same size. As a matter of fact, most people, it's more narrow and just slightly longer. So it kind of looks like a cell phone. In addition, I'm going to see if I can get you close. You can move this to change the angle. And most of the practitioners don't realize. So here it is straight. But if I wanted to get under my chin, for argument's sake, I could move the tip and get in there. And that works really well when you want to go in the occipital ridge and the occipital triangle. Another thing that you'd want to do with somebody who had a concussion, because we all know the occipital triangle gets damaged with the whipping of the concussion. And the most common muscle is the rectus capitis posterior minor. But again, to finish off with what we were saying, we have to treat ourselves. I mean, especially me, I have my musculoskeletal thing going on over here. So I'm able to treat myself. You know, my wife is wonderful, but she's not a licensed chiropractor. So I can't ask her to give me a cervical adjustment. And with the fusion in my neck, the laser was a great choice.
And it's so, as soon as you said portable enough to obviously travel with, obviously we were talking about for kind of personal use, but my thought then too was like pop-up clinics kind of around the world as you make your way around the country or make your way around the world.
More so than just pop-up. That's a great point. Pop-up clinics, but these are sports docs. So when you're on a field, you're at an event, you can put it in your pocket. It's not something that you have to wheel. It's not something you have to carry. You can put it in your pocket and it's not an issue. Plus, being what we call here a class 2, you don't need to use goggles because there's no damage to the eye. The blink reflex protects the eyes, and that's a huge takeaway. Some of the other lasers that are on the market, and we're not here to bash anything at all, some of the other ones you really are supposed to use goggles and etc. Now, one of the other things is you don't need it to be plugged in. So you don't have to carry the stand while you treat. You would just bring it home, put it in the stand, and then it would recharge. Again, the flexibility, the portability, the effectiveness. Let me know how I can win my free Accelerate, because I'm going to try and rig it for myself.
Yeah, absolutely. And what you mentioned too about like being at games, obviously we're so incredibly excited that games are kicking back into gear again. I know we've got Waco kickboxing coming up in October, and we've just had jiu-jitsu. We've had chiropractors serving as volunteers at jiu-jitsu. So absolutely fantastic that you can travel with us and, as you said, take it onto the field. But yes, so with the Accelerate, so if you want to win the Accelerate laser that Fix is currently giving away with Acronia, you can jump over to the URL on the screen right now, which is fix.sport/contribute. And this is coinciding with a really exciting phase for Fix. So we've recently launched the Fix charity, which supports student scholarships, it supports education, it supports research, and it also supports volunteers at games. So as we were just saying, we have games that are kicking back into gear now, that we're travel's coming back and live events are coming back. So we're incredibly excited to be getting chiropractors back out into the fields and doctors back out into the fields. So definitely jump over to fix.sport/contribute. Every donation that you make, no matter how large or small, there are 4 different options there, will earn you tickets into the draw to win this incredible Accelerate handheld cold laser. And that's being drawn at the end of the month. So there are still 3 weeks to go. So share the news. Maybe that goes against you sharing the news, might kind of go against your chances of winning by putting it out there, but please do share. And I was going to ask you, Dr. Rob, how are your patients responding to laser therapy in terms of like what are their kind of responses and like testimonials being about like loving laser therapy type thing?
You know, it's funny that you bring that up. People always ask, how do you get all your new patients, and how do you perpetuate your practice? And of course, the word of mouth is still the best. We do have social media. I write articles and I do social media, but the laser is a patient magnet because of its effectiveness, and there's no pain involvement. Some people just don't want to get touched. Some people don't want that trigger point released. So the laser is a patient magnet. So they're responding really well, from the ages of 8 to 80. And one thing I wanted to kick in, the person who wins it, I'm going to up the ante a little bit, because you're going to get this laser and you're going to want to know how to turn it on and what to do. You get 30 minutes with me, guaranteed free. I'm going to show you how to turn it on. I'm going to walk you through it. And I'm going to throw my friend Simon Ramshaw under the bus. I'm going to get him for that 30 minutes to be there, because right now, if you heard that, without question, he dropped whatever beverage he had in his hand. So the 2 of us are going to get on with that person who wins. And if it's someone in America, I'll substitute someone in America because the timing will be better. And we will work you through it so you know how to use it, because once you know how to use it and once you turn it on, it's ready to go. Now, speaking about use it, all you have to do is press play and just point and shoot. And that's it. Point and shoot.
Love the simplicity too.
Yep. Just turn the power on, point, and get ready and go. Don't overthink it.
And we have you saying that live. So we have you on film. You heard it all live here first. So for the person who wins, for the clinician, the doctor who wins the Accelerate handheld cold laser, you additionally get a 30-minute date with Dr. Rob Silverman for running through the applications, how to turn it on, how to use it, as well as Dr. Simon Ramshaw, who we may need to let know that you've just offered that for him, but I'm sure he'll be just excited.
I'll make sure I let him know about 10 o'clock my time, 4 o'clock his time, a.m.
Perfect. Well, if anybody does have any questions, feel free to ask them. This is your last chance to ask them live, but obviously the replay always stays available on on our Facebook page, on our website. We'll also be sending this out to the Fix members via newsletter blast. We've just had a comment from Mustafa, has said, thank you for your time, Doc. Acronia has just been so great. Absolutely agree. And obviously everybody who's been watching now can see the benefits of applying laser therapy within your practice, not only within your practice, but as Dr. Rob's just said, just the practical application of being able to travel with these devices. They're so portable to take to games if you are volunteering at games, to take home with you if you are training yourself. So many different applications. So yes, thank you so much for joining us. Did you have any kind of last words, Dr. Rob, to encourage anyone who's been thinking about introducing laser therapy into their practice or into their clinic but hasn't yet taken the plunge?
I have two things. One, don't be late on the laser wave. And number two, somebody once famous said, let there be light.
Love it. And obviously, if you are thinking about introducing it, jump over to our website right now. URL's on the screen. Enter to win the Accelerate handheld cold laser for Acronia. Thank you so much, Dr. Rob Silverman, for joining us today. You can find Dr. Rob on his Facebook page. We'll be including the link to his page as well to further connect with him. And it's just been a pleasure to chat with you again today.
My pleasure. Hope to see you soon. Congrats, by the way.
Thank you so much.